Hey everyone, my name is Dr. Tanno Kaur. I'm with Greater Washington Advanced Podiatry, and today we're going to be discussing part 2 of our very special Achilles series. So in part 1 we had discussed Achilles tendinitis, and now in part 2 we will be discussing Achilles tendinosis. So essentially, the Achilles tendon, a little bit of review from last time, is the strongest and largest tendon that runs in the lower extremity. It runs from the back of the calf all the way into the calcaneus or the heel bone, and we can get a tendonitis right in here at the insertion of the Achilles tendon. A tendinosis is when a tendonitis has lasted for approximately 3 months or more. So in terms of conservative treatment, I would always try the same, conservative treatment options that we utilize for Achilles tendonitis, essentially, proper offloading, proper stretching, the toes to the nose stretch that we talked about in the first video, as well as, the Achilles wall stretch with the knee extended and the knee flexed. I would try a course of anti-inflammatories for my patients, and then I would definitely recommend physical therapy for patients with tendinosis because studies show that therapy is extremely effective, specifically for Achilles pathology. If patients were not improving with these treatment modalities, there are further more advanced surgical modalities that we have that are extremely minimally invasive and require little to no downtime. One of those being a radio frequency ablation wand technique, where we essentially go into the tendon, make very small percutaneous incisions, and the radio frequency ablation wand essentially helps create an inflammatory process, and this inflammatory process essentially helps the body heal itself. Again, this is extremely minimally invasive. Patients are, weight bearing immediately, and they generally feel better in a few weeks' time. Another technique that we have and that we utilize, again, extremely minimally invasive, is essentially a percutaneous tenotomy technique where we go in with an instrument that delivers an extremely high speed saline jet. This helps, debride or remove any part of dead or devitalized tendon. And once we're done, we basically suture the very small percutaneous incision that we have made. And again, patients can go to be immediately weight bearing, and they're back to, full level activity within a couple weeks' time. So if you believe that you are suffering with Achilles tendinosis, please go see your local podiatrist. Our goal at Greater Washington Advanced Podiatry is always to get our patients, pain-free, back to their level of mobility and independence as early as we can. Please go, get proper treatment if you believe you are suffering, and I really appreciate you watching. Thank you so much.